Assalamualaikum warahmatullahi wabarakatuh. Good day everyone and welcome to today's webinar titled Building Resilience in the Workplace Safety and Health Advancing Compliance through the Code of Practice for the Workplace Safety Health Management System. My name is Zaharuddin bin Haji Rahman from the Compliance and International Division, and I will be your presenter for this session. We are glad to have you with us today, whether you are joining us as the workplace safety health professionals, business owner, or a part of safety and health management team. Here is a quick overview of today's agenda. First, the introduction to the code of practice for the workplace safety health management system. Secondly, the legal requirements. Next, the 14 elements of the workplace safety health management system. And lastly, we'll go through the workplace safety health auditor registration criteria. The Code of Practice for the Workplace Safety Health Management System serves as a guidance document that provides an overview of the key concepts and principles of a safety and health management system. Specifically, it is aligned with the 14 elements of the Safety and Health Management System as outlined under Schedule 2 of the Workplace Safety Health General Provisions Regulation. These elements form the foundation of a structured and effective approach to managing safety and health risks in the workplace. It also acts as a practical tool to help organizations enhance and continuously improve their workplace safety health performance. It also supports alignment with the relevant laws and regulations, making it easier for companies to stay compliant while proactively managing risks. The code is also intended to be a self-regulatory tool. This means it empowers workplaces to take ownership of their workplace safety health management systems, managing them systematically and effectively without waiting for enforcement. One of the critical success factors in implementing a robust workplace safety health management system is the consultation and participation of workers. Workers are the ones most familiar with day-to-day operation, risks, and challenges, so their involvement is essential to ensure that safety measures are practical, effective, and well accepted. Under the Workplace Safety Health Work Safety Health Committee regulation, workplaces with 50 or more workers are required to establish a Workplace Safety Health Committee. This committee provides a formal structure, serves as a platform of consultation between workers, employers, and on all matters relating to workplace safety and health. By encouraging open dialogue and a shared responsibility, consultation mechanisms like the Workplace Safety Health Committee help to drive continual improvement in the safety and health management system. This diagram illustrates the evolution and progression of the safety and health management system within an organization. The goal is to mature from the basic company-specific system to the one that aligns with the international standards and ultimately complies with the national regulatory requirements. Verification of the safety health management system can be done through the third-party auditors for independent assurance and certification, as well as internal auditors to assess performance and identify areas for improvement from within. This slide shows the legal requirement of workplace safety health management system in Brunei Darussalam in the existing Act and regulations. First, the implementation of workplace safety health management system is a regulatory requirement in all work sites, factories involved in processing or manufacture of petroleum products, petrochemicals, or petrochemical products, factories engaged in manufacture of semiconductor wafers, factories engaged in the manufacture of fabricated metal products, machinery, or equipment where 100 or more persons are employed. For workplace involved in the building operation or engineering work of engineering construction, where the total contract value is less than Brunei dollar 30 million, the workplace safety management system must be reviewed at least once every 6 months. However, for projects valued at Brunei dollar 30 million or more, or for high-risk industries such as petroleum processing, semiconductor wafer manufacturing, or metal fabrication plants employing 100 or more workers, a third-party workplace safety auditor must be appointed to conduct a formal audit of the Safety and Health Management System, or SHENS. For your information, the Workplace Safety Health Management System and Auditing Regulation is currently in draft. This new regulation will serve as additional requirement for the Workplace Safety Health Auditor, an additional workplace which requires implementation of Workplace Safety Health Management System, a review and appointment of Workplace Safety Health Auditor with frequency. This slide provides an overall view of the 14 elements of the Workplace Safety and Health Management System. These elements form a foundation of comprehensive and effective workplace safety health management system, helping organizations to manage safety and health in a structured and systematic way. The Plan, Do, Check, Act, or known as PDCA cycle, is a core principle behind the continuous improvement of any management system, including the workplace safety health management system. The 14 elements of safety health management system, as outlined in the Workplace Safety Health General Provision Regulation, can be grouped and aligned with each phase of the PDCA cycle, as illustrated here. By aligning the 14 elements with the PDCA cycle, organizations can systematically implement, evaluate, and refine their workplace safety health practice to ensure ongoing effectiveness and compliance. First, we go to the first element, falls under the plan, which is the workplace safety health policy, risk assessment, competency, continuous education, training and awareness, emergency preparedness and response, as well as system for evaluation, selection, and control of contractors. One of the fundamental elements of an effective workplace safety health management system is a clearly defined workplace safety and health policy, including objective, plan, and responsibility for safety and health, which sets a direction for safety and health within the organization. A good workplace safety health policy must be specific to the organization operation, scale, and risk, formally authorized by top management, demonstrating leadership commitment, developed in consultation with employees and their representatives, ensuring relevance and buy-in, readily available and accessible to all workers, including contractors and visitors. The key principles and objectives typically covered the policy include a strong commitment to providing a safe, healthy working environment, prevention of the work-related fatalities, injuries, disabilities, and ill health, full compliance with the national legislation and regulation, the elimination of hazard and minimization of safety and health risks, as well as active consultation and participation of employees in all workplace safety health matters. Workplace safety health objective must be clearly developed and documented across all relevant functions and levels of organization. They act as a practical targets that help guide and drive continuous improvement in both workplace safety health management system and overall workplace safety health performance. To do this effectively, an organization needs a well-defined workplace safety health plan. This includes clearly identifying the resource required, the personnel responsible for each item, the target item for completion, and a method for evaluating the outcome. Moving on the workplace safety health organization. This part outlines the structure that supports the implements policy. This includes clear definition of duties and roles within the organization, assigning specific responsibilities such as appointing the OSH focal point and establishing a clear communication line that shows how these roles interact and report, which is critical to ensuring accountability and clarity across all levels. In a sense, this structure forms a backbone of the workplace safety health management system, turning policy into action to well-defined goals and an effective organizational framework. Now let's talk about the cornerstone of every workplace safety and health management system, which is the risk assessment. At the heart of the risk management is identification and management of existing and potential hazards at the workplace. This means proactively spotting what could go wrong, not just reacting to the incidents after they happen. Organizations are required to establish, implement, and maintain documented processes for hazard identification and risk assessment. This also includes defining the methodology, how you conduct the risk assessment, and the criteria, how you determine what level of risk is acceptable or not. Next, we move on to the vital element of an effective safety and health management system: competency, continuous education, training, and awareness. The purpose of this element is twofold. First, to ensure that all employees are competent. This means they must have the right combination of qualification, training, and work experience, along with the ability to identify hazards relevant to their roles. Second is about equipping every employee across all levels with the skills, knowledge, and safety-related information that they need. This includes understanding their operations, how to safely manage work processes, and how to maintain equipment effectively. To support this, organization must develop a training matrix. This isn't just one-time record, but it's a tool for ongoing maintenance and continuous improvement. The matrix should allocate the right resources for training and capture legal and mandatory training requirements specific to different roles. Another key point is ensuring that training records are retained and well documented. This helps demonstrate compliance during audits and reviews and ensures the employees are consistently up to date. And finally, where applicable, the employer should analyze opportunities for continuous learning, whether that is through refresher courses, upskilling programs, or offering employees the chance to gain additional qualification. This slide summarizes the key training requirements to ensure a competent and safety-conscious workforce. We can have a mandatory training requirement by legislation, training qualification required for the workplace safety professionals and practitioners. It also can include the safety and health induction, orientation awareness, and in this slide we show the examples of what are the components inside the induction. Specific competency skills to safely operate high risk and critical activities. Training required for employees to conduct investigation as well as emergency response training, which also is part of the training that should be incorporated in the training matrix. This slide highlights the importance of having a robust emergency preparedness and response plan, which is a part of the element in the WSH management system. It covers potential emergencies like fires, explosion, structural failures, chemical spills, and natural disasters. Key components include clear communication for both internal and external, emergency procedures and evacuation plans, medical aid, firefighting resources and trained responders. And it's also equally important to ensure the coordination within government authorities and local communities, availability of proper emergency equipment, and regular drills and exercise, which need to be fully documented to test and improve preparedness. This ensures a swift, organized, and effective response in any emergency situation. As part of the 14 elements as well, the system for evaluation, selection, and control of contractors, which plays a vital role in ensuring that all outsourced work is carried out safely and responsibly. Under the Section 14 of the Workplace Safety Health Act, Chapter 277, the duty of principal includes evaluating the safety performance and competency of all contractors before any work begins. It starts with evaluating contractor performance, checking the competency, confirming the workplace safety health requirements are provided before work starts, and ensuring risk assessment is conducted. Ongoing monitoring includes periodic inspection, reviewing training records, and tracking incident statistics. In selecting contractors and subcontractors, we must embed workplace safety health criteria, formalize expectation through a workplace safety health bridging document, and establish clear communication channels for hazards and control measures. Finally, don't overlook the importance of workplace safety health induction and briefing for contractors and their workforce before commencement of work. This will safeguard workers, everyone involved in the work activities. In the do phase of the workplace safety management system, we focus on the implementation and execution of plans laid out during the planning stage that includes group meetings, safety and health promotion, safe work practices and procedures, maintenance regime, management of hazardous substances, as well as occupational health program. Group meetings are designed to formally identify and address workplace safety health issues and to take appropriate coordinated action. In this code of practice, again, it emphasizes further involvement and active participation of employees in group meeting to discuss workplace safety and health concern. Workplace Safety Health Committee meeting, with the minute of meeting documented, should discuss the current workplace safety health issues, review incident reports, or near misses. Other relevant meeting includes site coordination meeting, toolbox meeting, as well as management safety meeting. The next element highlights the importance of using effective communication tools and programs to promote workplace safety and health at the workplace. These include workplace safety health information boards, in-house talks and seminars, email reminders, and safety videos. We also highlight audit results and run engaging activities like campaigning and contests. On top of that, we encourage physical wellness by promoting office workout, stretching session, using the stairs, using of lift, and ensuring access to exercise facilities. This initiative helps build a safer, healthier, and more active workplaces. The safe work practices are general rules on what should and shouldn't be done to perform tasks safely, aligned with the industry standards. Meanwhile, safe work procedures are detailed step-by-step guides that ensure tasks are done safely from the start to the finish. covering planning, approval, mobilization, construction, and demobilization. These procedures must be documented and cover high-risk activities like working at height, confined spaces, electrical work, hot works, and machinery use. Having clear practices and procedures help reduce the incidents and keep everyone protected on site. A proper maintenance regime is crucial to ensure the safety of all plant, machinery, equipment, and tools. Organization must have a documented preventive and corrective maintenance program, which includes regular inventory checks, inspection schedules, repair procedures, PPE usage, and maintenance record. All maintenance must follow the manufacturer recommendation, and any defects must be documented. During repairs, only competent persons should carry out with a proper warning signs to removal from the worksite and certification before use. These steps help prevent breakdown-related accidents and ensure safe, reliable equipment in the workplaces. The safe management of hazardous substances covers their storage, transport, use, and disposal. Organizations must establish clear procedures and ensure safety data sheets are available for all exposed workers. Substance must be controlled by a competent person and storage must be followed using the globally harmonized system GHS. Key measures include the secure storage areas, monitoring exposure level, proper disposal processes, regular health surveillance, and effective emergency response for spills and incidents. Clear communication is critical to ensure all the users are aware of the associated hazard. The occupational health program is designed to protect workers from various health hazards such as fatigue, noise, hazardous substance, radiation, and excessive heat. It involves planning and implementing policies and procedures to safeguard both physical and mental health at work. These include conducting health risk assessments and engaging competent persons to monitor workplace environments, especially where toxic substances are involved. Supporting programs include hearing conservation, respiratory protection, ergonomics, mental health awareness, heat stress management, infection control, and medical surveillance, particularly for those in the hazardous occupation. In the check phase, we assess whether our safety and health measures are working effectively. Safety and health inspections aim to verify the workplace safety health provisions are in place and meet the legal requirements. We must establish and maintain documented procedures for routine and specific inspections, covering equipment, incidents, and high-risk operations. Inspections should use a checklist to ensure consistency, and findings must be recorded, reported, and communicated to the responsible parties. Importantly, inspection must lead to action by identifying causes of non-compliance and implementing timely corrective measures to prevent reoccurrence and improve safety. Incident investigation is a critical part of the check phase, ensuring we learn and improve from workplace incidents. We must establish and maintain procedures to notify, report, investigate, and record all incidents, including types to be investigated and follow-up action. Investigation should be done by competent persons with participation from employees and their representatives. The goal is not just about finding out what went wrong, but to recommend corrective actions, prevent recurrence, conduct train and statistical analysis, and capture and share lessons learned. This process helps drive continuous improvement in workplace safety and health. Next, to continuously improve our workplace safety performance, we must regularly evaluate our systems through 4 key approaches. First, we conduct evaluation against legal requirements to ensure all the local laws are identified, reviewed, and integrated into the system. Second, the internal review of the workplace safety health management system, which ensures the system remains appropriate, sufficient, and efficient. It includes reviewing the workplace safety health policies, targets, incidents, root causes, and follow-up from the past reviews. Third, we perform internal audit to verify compliance with the workplace safety health management system carried out by competent and independent personnel. And lastly, an external audit is done by a qualified third-party workplace safety health auditor, offering impartial insight and recommendations which the workplace must act without undue delay. And the last phase is the act phase, where we end the loop of the PDAC cycle. It involves enforcing in-house safety and health rules and regulations based on the findings from inspection, audits, and reviews. Any nonconformities identified must be addressed through effective corrective actions, and improvement should be implemented to prevent recurrence. The in-house safety rules and regulations are tailored specifically to the organization work environment to guide safe work practice. This may include the rules of housekeeping, PPE use, chemical handling, signage, incident reporting, evacuation, and traffic or smoking policies. It is essential that these rules are well communicated to all workers and updated regularly. A review process should be in place to revise rules whenever corrective action reveals gaps or risks, ensuring ongoing compliance and workplace safety. To strengthen the workplace safety and health, we must take prompt corrective actions whenever nonconformities are found, with a clear goal to prevent recurrence within a reasonable time frame. We also focus on continual improvement by identifying workplace safety health opportunities and regularly reviewing our workplace safety health policy. This process involves or includes encouraging active participation, sharing feedbacks, and maintaining proper documentation. By embedding these habits, we foster a strong workplace safety health culture that continuously evolves and improves. Next, we look at the evidence, the checklist that is also incorporated in the Code of Practice, where this will act as the evidence required for the compliance of the Code of Practice. This checklist can also be used for the workplace safety health auditor to basically use in terms of the thorough check of the system in the workplace, as well as the workplace to do self-assessment within their workplace. To be approved as the workplace safety health auditor in Brunei Darussalam, candidates must meet specific criteria set by SHENA. They must be employed in Brunei, pass the internal interview assessment, and demonstrate relevant experience, either at least 5 years experience in the workplace safety health related field, or for those with degree, or at least 8 years of workplace safety health related experience for those with no relevant degree. A minimum qualification, which is NIBOSH International Diploma, is required along with the certified ISO 45001 Lead Auditor Training CQI IRCA accredited course. Additionally, candidates must complete workplace safety health legislation course and finally show at least 2 years of auditing or consultancy experience in safety health related system. This ensures auditors are not only qualified but also experienced and competent to uphold workplace safety health standard. You can visit SHENA website for more information. As we conclude today's session, let's reflect on the core message of today's webinar. Resilience in the workplace safety and health isn't built overnight. It requires a deliberate, structured, and continuous effort grounded in compliance, leadership, and workers' participation. The Code of Practice for the Workplace Safety Health Management System serves as more than just a guideline. It is a practical framework that helps organizations systematically manage risks, meet legal obligations, and most importantly, foster a culture of prevention and accountability. By aligning our practices with the 14 key elements of the Safety and Health Management System and embracing the plan, do, check, act cycle, we can move beyond basic compliance and towards a truly resilient and proactive safety culture. Let us take all ownership of our systems, empower our teams, and continue advancing workplace safety health excellence, not only to meet regulatory requirements, but to protect life, enhance performance, and future-proof our workplaces. Should you have any question, please feel free to scan the QR code and leave them there. We will have a chance to address them in a panel session during our very last webinar in June. With that, thank you very much.